Hi, Dr. Shiller here. So I just got a message from someone who was referred to me, who explained her sort of clinical situation and was asking the question, do you think I have fibromyalgia? And it's so important to think about this carefully because um, we all know it's a challenging diagnosis. It can be challenging to get the diagnosis. It can be challenging to know what to do when you have the diagnosis. It can be challenging to understand, okay, I have a diagnosis of fibromyalgia, but I have these other problems. What do I do about them? I've got this new symptom. Is it the fibro? And so these are things that a lot of people get very mixed up about, and it's very understandable why. And so I want to try to shed some light and clarity about a way to think about it that could be useful to you if you're in that situation of, do I have fibromyalgia? What do I do about it? So let me first just express what she described to me, and then I'll describe how I think about it, okay? So this is a woman in her mid-30s who's always been a very hardworking, productive, active, energized person. And she's been suffering for years, 10 or 15 years or so, from allergic symptoms and headaches and migraines, as well as a lot of premenstrual symptoms and like bodily pain, especially around her menstrual cycle. She had some early life adversity, from what I can tell, and but she'd been sort of functioning and dealing with things okay. And then roughly 4 or 5 months ago, she had some traumatic experiences. There was kind of losing her housing and then working in under unfavorable, really hard working conditions in the heat, and then kind of a threat type experience with someone who felt like this person was stalking her, and then becoming homeless and needing to live under very difficult circumstances. And so as a result, over the past 3 to 5 months or so, there's been a lot more widespread body pain, as well as a lot of brain fog, difficulty thinking and concentrating, and really kind of feeling like her life is falling apart. She had been working hard in exchange for housing, but couldn't do that work anymore because the symptoms and the exhaustion and the bodily pain. So let's sort of break this down and first think about the question of, do I have fibromyalgia? And fibromyalgia is what we call a diagnosis of exclusion, and that means it's a constellation of symptoms that is called a syndrome because conventional medicine doesn't fully understand the pathophysiology. Conventional medicine hasn't fully mapped out, here's what causes fibro. A leads to B. And my view of that is because it's a more complex process than that, and it shows up differently in different people. And we do know a whole bunch of underlying physiologic, biologic issues that show up in people with fibro, and it's probably more of a systems problem where a lot of different issues are going on that give rise to the symptoms. We'll talk about that more later. Let's get back to the practical question of, does she have fibro? So it's a diagnosis of exclusion because we don't have one thing that points to, oh yeah, this is fibro. And hopefully I'll talk about that more because there are these things that have shown up and everyone's like, oh yeah, there's biome abnormalities in fibro, or there's immunological abnormalities in fibro, so we'll be able to diagnose it. No, it doesn't work that way yet because of the complexity of, like I was talking about. So what we have for now is a diagnosis of exclusion, which means it's really important to get other things checked out. People can have a variety of different sort of underlying medical issues that can flare up under certain situations of increased stress, like this person that I'm speaking about. She had these underlying migraine, headache, premenstrual, hormonal type things going on, and then under a situation of a whole lot of stress and threat, kind of flared up into this widespread pain and worsening cognitive function. And that could be a flare-up of an autoimmune disease. That could be a flare of some sort of neurologic issue or something that's infectious. And it's really important to find a thoughtful, careful physician who's not just blowing you off and saying, oh yeah, you're just a complainer or you just have fibromyalgia, who can look at the situation and say, oh yeah, this is a clinical change. If there was a bunch of testing that was done in the past, we should retest it. It's well known that, for instance, rheumatologic diseases, things like lupus and rheumatoid arthritis, psoriatic arthritis, it can be years between the first show up of symptoms like joint pain, aching, fatigue, things like that, and an actual diagnosis. People can have serologic evidence, a positive test like a rheumatoid factor or an ANA or an elevated SED rate or CRP, which are sort of non-specific signs of inflammation. And it can be months or years before, okay, now the person has lupus or now the person has rheumatoid arthritis. Because these are processes that develop over the course of years. Genetics interacting with lifestyle, the river flows downstream and the process unfolds. It's complex. So the point is like this, getting a workup. If there is some kind of joint aching, pain, febrile thing, if your primary care doctor doesn't know how to figure it out, see a rheumatologist. Let them do a slew of tests that figure out, okay, you do or you don't have an autoimmune disease. And if you don't, you have someone to actually stay connected to, because in a year or 3 years or 5 years, if things change and get worse, you can go back to that person and say, look, things have gotten worse. Can we look into this again? And they can reevaluate it and clarify whether you've developed an actual rheumatologic disease. And you could say the same thing about neurologic illness. So the idea is not to get panicked and freaked out, but the idea is to methodically take advantage of what conventional medicine does best, which is diagnose disease. And they can't always diagnose a disease. In people with fibromyalgia, there might be no other disease, so to speak, that has a specific diagnostic marker or clinical pattern, and that's why we call it a diagnosis of exclusion. But it's important to check those other things out first to make sure there's not something else brewing. Hopefully that makes sense. In the meantime, though, well, what do you do? Because, for instance, this person who reached out to me is suffering a lot and not able to function so well, and in kind of a vulnerable situation of needing to get better. And so while you're waiting for all that workup, what do you do? So let's talk a little bit about the pathophysiology, the underlying issues that seem to show up a lot in fibromyalgia. One of the most prevalent things that pretty much even docs who are not so fibro-literate, if I could say that, would acknowledge is that there is this aspect of what we call autonomic imbalance. The autonomic nervous system is the nervous system within your nervous system, the brain inside your brain that biases your energy and your biological functions towards one of two situations. You have a stress response and you have a relaxation response. Your stress response is fight, flight, freeze, get up and go. I got to deal with the situation. I got to work hard. I'm going to play soccer. There's a fire. I got to run away. There's a tiger running down at me. I need to pick up something and either shoot it or hit it, or I need to defend or protect myself. And then there's a relaxation response, which is more like rest and digest. I'm going to assimilate nutrients, remove waste products, resets my all of my physiologic responses, enables me to sleep, generate neurotransmitters, do all the stuff that's involved in health and maintaining the body. So what we know in fibro is that there's an imbalance in that system leaning towards the side of that fight, flight, freeze stress response. And that can show up different ways depending on how chronic it is. It's really complex physiology, and I talk about it in another video. But the point is that especially in a situation where someone has had early life stressors, and that could be trauma, living through a war, being a victim of violence or sexual or interpersonal abuse, even someone who had, like around the time of birth, some sort of illness or sickness, becoming really sick as a child can, just like these other traumatic experiences, create an overactivity of that fight, flight, freeze response. And it's kind of like the body develops a posture of protective responses. And that shows up in your thought processes, your emotional responsiveness, and your physiological or biological responsiveness. And that has huge implications because your stress response is so intimately connected with your immune functioning. And it kind of makes sense because if part of my stress response is I'm in a war or I'm injured and something horrible is happening to me and I need to protect myself, well, part of what my body needs to do is mount an immune response because, like, when you're in a war or you're injured or attacked by a wild animal, your immune system needs to be functioning at a high level because you may have some sort of, infectious thing, dirty wound, whatever it is. So everything's connected to everything else. Your immune response and your stress response are profoundly integrated with the functioning of your gastrointestinal system as well. And so we're seeing more and more as research develops that we have this gut-brain axis, and that early life adverse events as well as stressful traumatic events can create a shift in intestinal functioning, can create a shift in the biome, the natural bacteria that live in the gut, and modulate gut function, and in turn modulate brain function, as well as a breakdown in that natural barrier functioning of the gut. Your intestinal lining has to have an exquisite balance of letting the right stuff move through so you can absorb nutrients and fluids, and keeping the right stuff in your intestine. Your intestine's like the outside of your body. Think about it. Food goes in from the outside, so you've got an immune response the moment something hits your mouth and into your throat and down into your intestinal tract. Like, there's all this surveillance going on, and it's all about making sure that your body doesn't get exposed to some kind of infectious pathogen or other pathogen or other toxin. And so when that luminal, that layer, that barrier of the intestinal system breaks down, basically you get translocation of stuff from your gut into your blood system and your circulatory system that can stimulate autoimmunity and can stimulate increased immunity that might not even be autoimmunity. And that phenomenon is showing up in so many different disease processes. If you look in almost any specialty journal, whether it's neurology or psychiatry or rheumatology or general medicine, endocrinology, so all of these diseases of chronic diseases seem to be associated with some degree of generalized low-grade inflammation, and are more and more associated with a breakdown in this gut-brain axis and shifts in that. And so profound stressors can trigger that. So stepping back to the case of fibromyalgia, and this woman who reached out to me, who had some early life adverse events, some ongoing hormonal challenges, headaches, different stuff, but she was dealing with it. And then about 5 months ago, a whole bunch of really significant trauma and difficult circumstances in life. And then her system just tanked. And we see that a lot. In the world of sort of integrative functional medicine, we talk about antecedents. Antecedents being what's going on early life, what's going on lifestyle, various events at an early age and on younger part of a person's life, as well as genetics. And we talk about triggers. And triggers are things like really significant stressor, becoming homeless, being the victim of a stalker, being a victim of violence, or having an acute illness. And so many people develop fibro symptoms after some kind of trigger like that, because what it does is it takes this autonomic, intestinal, hormonal, gut-brain system, and it's already primed, and it's a little bit dysfunctional, and it's trying to cope with sort of the body's perception of being under low-grade threat, and then boom, you hit it with another stressor or triggering event that is traumatic, stressful, either in a physical, emotional, mental, or biochemical way, and the system tips over. And so it becomes really important to bring the system back to a place of safety, essentially. And so I can't give medical advice on Facebook or YouTube, but the advice that I would give someone in the position of the person who reached out to me, who I described in this video, is one of the most profound things and important things is getting at that autonomic dysfunction and finding calm. And one aspect of that could be working, if there's a specific trauma, working with a therapist and remembering that that's got different levels to it. There's a level of cognitive therapy of talking things through. There's a level of behavioral therapy about the life choices you make and the way that you habitually perceive your reality as threat or non-threat, as I can do this, I can handle it, or I can't handle it, so that you don't feel as overwhelmed, so that you can actually have a sense of positive coping and a positive outlook about how you can work with situation. It also involves working with that underlying stress response, the limbic system, the emotional responses of the body. And that's a deeper level of work that can take the form of meditation or certain techniques like EMDR and other psychotherapeutic techniques, somatic experiencing. These are things that are about retraining and reconditioning the nervous system and the autonomic nervous system to sort of tone down that hyperactive protective response that it can get locked into, especially when there's early trauma and then some triggering event. And the third level is actually physiologic, right? And in my eyes, that's where a lot of the mindful practices come in, whether that's just mindful awareness of your body, or some kind of mindful movement, exercise, yoga, tai chi, Feldenkrais. There's various techniques out there for cultivating presence in the body, where essentially what you're doing is you're meeting your sensory experience, you're meeting your physiologic experience, and you're bringing a state of calm and quiet and purposefulness to it. And it's really a retraining experience. Physical exercise can also contribute to that. When you get on a bike and ride, or go for a run, or have a really great game of soccer or tennis, what you're doing on a certain level is intensifying your stress response in a positive way. You're doing something positive that you like, that you feel good doing. Perhaps you're in a beautiful natural space, or you're doing it with someone you care about or like to be with, and you're intensifying your stress response, but you're doing it with a whole bunch of other chemical and sort of neurological functions that are associated with positivity and purpose. And not only does that activate all that positivity and purpose and like, hey, it's okay to be me, I'm doing good stuff, but it also activates your counter-regulatory balancing functions, and that's your parasympathetic or your relaxation response. Why do people feel so good after they work out frequently? Because the body compensates that intense stressor by producing a whole bunch of chemicals, endorphins, enkephalins, other things that basically create that sense of calm and feeling well in the body. So those are some of the things that are incredibly important to address that mind-body connection. And there are the other aspects to in a situation that looks like fibromyalgia, to address some of the biological functions. I'll talk about that in other videos. I think the main categories are thinking carefully about nutrition and diet, and there's a lot of different aspects to that. One of the biggest things is like avoiding the simple comfort foods that often feel good, like really sugary, fatty, saturated fat, simple carbohydrates that can actually contribute to inflammation and can contribute to mental emotional instability. And so that's one thing, and there's many different details about how to do that. And the other thing is that in the case of people who have fibromyalgia, there's a bunch of nutrients that can be useful because they can not only sort of calm the nervous system, but they can help support the function of the mitochondria. And the mitochondria are the energy-producing organs inside your cells that seem to be impaired in people with fibro. And so there's a lot of mitochondrial nutrients, things like coenzyme Q10 and alpha-lipoic acid, L-acetylcarnitine, PPQ. The list goes on. You know, knowing which ones are appropriate for you, it's some trial and error. It's best if you speak with someone who's an expert at these things. There are other nutrients that are very involved in helping your body clean up oxidant stress and immunologic overactivity, stuff like curcumin and quercetin. There's a natural substance that's called PEA, or palmitoyl ethanolamide. There's also a molecule called LDN, and LDN is a kind of blocks the opioid system temporarily in the body. It's a synthetic compound. In any event, a lot of people with fibro get benefit from that. So that's just a brief overview. It's a complex thing. The most important things that you can do are lifestyle, are doing things to create that sense of calm and well-being in yourself, modulate that stress response, relaxation response, connect to things that are purposeful, connect to nature, um, eating a relatively low antigen, low inflammatory diet, and then I think that's probably good it for now. Okay, thanks a lot for watching. If you want more info about dealing with fibromyalgia and related conditions, you can go to a Facebook group that's called What Heals Fibromyalgia. And you can also look in the notes here where you can sign up to get on my email list and join my email community. And I look forward to seeing you. Thanks a lot.